All right, so this is the inaugural Jefferson County Health and Human Relations Commission meeting. Short on attendees, but that's okay. We're getting a lot of just background information and talking about what are some things that we'd like to look at over the years. So just a little, I kind of went through it earlier, but background, you know, it was something that did come up in the comprehensive plan that was adopted 2 years ago. And then some folks approached me, or approached the county, I think maybe it was just me, but the commissioners, to say if there was any plans, once again, independent of the comprehensive plan, any plans to start a Health and Human Relations Commission. And like I said, it's nice to have people kind of support the ideas that have been put together in a comprehensive plan. So we took a while just talking about what it would be and, you know, kind of some ideas on what we want to focus on. So yeah, I mean, it took us about a year, and we interviewed some folks and talked to folks to see if they'd be interested. And like I said, we initially had set it up for 7, but we had 9 people that were interested. So we thought that would, there's no sense telling someone no when they're really upset. 7 wasn't any magic number. It was just a number that was selected. So, and I think pretty much, there may have been a couple that said we'd like to wait and see, but most everybody we interviewed were, yeah, they want to be involved. So it's good. Next on the agenda was going to be election of officers, but without a quorum, we won't be able to do that. The next one is just discussion of bylaws. I don't know if you have any, if you looked over Jane's comments or if you have some of your own. I just want to remind us, we kind of have talked about maybe next month having a version, and I'll get it out ahead of time, that we can kind of look at and vote on and approve and move forward with. So if you have comments you want to share now, you can, or if you, once again, if you want to wait till next month, like I said, that would be a time that I'll probably incorporate some of Jane's. If you have some, want to send them to me, then we can kind of put those all together and have something that we can try to vote on next month. If it takes a little longer, that's fine. That's not a requirement. We just trying to get something together before we move too far down the road with some bylaws. Any comments? Okay.
So you'll get those out to us, a draft.
Yeah. So I'd given a draft out at the last meeting.
Right.
So I will incorporate some of her comments in there and then send it out here in a week or so, and then take a look at those and send your comments back, and like I said, we'll try to put those all together and then have something we can vote on next month. Or like I said, it's not critical that it's voted on next month, but we don't want to keep pushing it on. All right, so next, I thought we'd do a little, I'm not sure I'm good at this, but brainstorming on just some topics that we'd like to either help the community with or talk about to the community with, just some things along that line. And I figured it was pretty easy, since we were a Health and Human Relations Commission, we could talk about some health topics. I know in some of our discussions with folks, you know, just what are some resources out there? You know, I mean, we have we had a veteran service officer at the site this week, and you know, sometimes you get into a government website, it gets very daunting. You can get lost, and you know, you just throw your hands up and go, all right, I'm done. Especially with veterans. I mean, maybe not especially with veterans, but veterans, you know, the older crowd, you know, they get on the computer and they're like, oh, this is, and then they just quit. I'm not going to deal with it. So maybe there's some things that we can do, like a veteran service officer would do for veterans, that we can do just for everybody. You know, just what are those resources out there that they need to know about, that would that's available to them, that either they don't know about or they've tried to access them and it's just not something they're able to navigate. So, I mean, I know one that was brought up was for people who need to use Medicare for a dentist, there's just no one in the county. And is that something that's that we can do something about? Or maybe it's just that and I've talked to a couple dentists and they said that it on their side too, it's too much to deal with. And so they've tried to talk to some folks in the state government, but I'm almost wondering if it's not a federal government thing, or if maybe there are some state resources where that would help them out. So I don't know if you know anything on the medical side as opposed to just the dental side, but if there are, you know, if you have contacts, I mean, that would be one way to have a seminar where people can come in and just, one, it's getting a point of contact, but two, just giving them some help and navigating some of these websites to see how do I at least find out what I need or what I have, maybe that's a better one. But so
there are no dentists that take Medicare.
not in the county.
Not in this county.
Wow. Yeah, so I guess one thing is just I had no idea. But maybe just the awareness of those needs might be a starting point. I would have no idea that was an issue.
Now, are there dentists in our surrounding, do we know if there's any dentists in our surrounding counties that will accept?
I'm pretty sure this particular person had to go to Clark County, so there is somewhat close, but still it's.
And I guess then the question is, are those barriers?
What are those?
What are those barriers in the mind of the dentist? Are they, you know, just that the reimbursement is low, or is it the administrative, work is cumbersome? And, you know, if it's administrative, you know, there may be maybe there's some county means to help with that. If it's reimbursement, I doubt that the county wants to subsidize the dentist.
No, I don't know that. And so, you know, I mean, is there another option? I mean, you know, that's usually it. Is there something in the state that maybe, you know, there's been a lot of things that changed in the healthcare world. Is there something out there where that's an option? And
Do we have a definitive reason why that they do not want to accept Medicare patients?
well, like you said, I don't, it's probably one of those two that he talked about. Either it's low reimbursement or it's just too cumbersome, but we can address that. We can bring in a dentist and have them kind of talk, because I know of the one at least I talked to, I think they would be willing to come in and talk, you know, what were their issues. You know, we had a representative from the Attorney General's office in the state. I don't know if they have any, or they may be able to at least point us in the right direction, who at the state level might be able to give us some information on how to at least, in this case, it'd be awareness to those folks about this issue. You know, I know this particular dentist had tried with the AG's office, but I don't know what came of it, but I just know that they had a discussion. So, but on the healthcare side, it's not that there are people in the county that take Medicare, right?
Sure.
So that's not. But,
I'm sure in the healthcare side, there's a component of people that, you know, are underinsured or whatever. I don't know how that would be teased out. But, you know, a lot of people I would presume are either underinsured or, you know, high deductibles with some cost barriers to healthcare.
I mean, do you think having like representatives from, I don't know what the state, the name of the state's kind of healthcare system, you know, to have someone like that come and just talk to folks and say, you know, here's how you maneuver the system, or here are some of your options out there. Do you think that would be a useful thing for?
I think it might be.
Okay. You know, the official name of the Indiana. Okay, well, nothing.
I believe it's the state health commissioner, but I'm not sure.
Another resource might be the health department.
Sure, and that's a good point. I mean, right now, there's a bill. I know there was some concern about how much it was gonna get funded, but where counties were gonna get more funds for health departments, and some of that was going to do some of these things. So it's a good point. I know it's still pretty new. I can talk to our health department director to see if she may, and I would imagine she's got access to some information. She may be able to digest it, some of it, to give us an idea on what are, what maybe some new things that are becoming available. Well, talk to Lindsay and find out. Yeah, we've had some discussions with her on other, because I know there are gonna be some requirements that the county health department is gonna need to provide to be eligible for the funding. And at least initially, it was like, we do those things already, so it's not, but, so she's had some idea of what are the services or what are some things that are coming with this new legislation that would be helpful. Hey,
Hi, you got my
Yeah.
message, sorry.
no, that's fine.
You get behind one slow person coming back from Bloomington, it just messes it all up. No past zones.
Yeah, I go from Carrollton to here, and every once in a while you find that just as well.
Yeah.
Well, we're glad you're here.
Yeah.
Thank
So I mean, we're down on the future topics. We skipped over election of officers since it wasn't a quorum, so unless you have a real problem, we'll get back to that next month. But we're just, trying to break down some things that we thought might be useful to, we'll get a list, and then I think we'll try to prioritize that list among ourselves, and then, where do we want to start? And there may be some pretty easy things to get started, I mean, we talked about dental, maybe. I know it was a dentist that has tried Medicare but had some issues with it, so maybe getting them to come in and just kind of help us understand what the issues are, and that would at least help us with, where do we go? Who do we, I mean, is there anybody, I gotta believe there's somebody, but is there anybody at the state that we talk to? Or maybe it's all a federal thing, or, so.
Right, or even maybe recruitment, just because so at most of the jails that I see, we have a mobile dental service that comes in. Are there ones like that that also just come into communities, right, to provide that service? Like that might be something as well.
Anything else?
We have resources here in Madison that if need be, or not so much Madison, Jefferson County, if need be, kind of like, that would be able to assist people to go to Jeffersonville, was it Jefferson or Clarksville, that has the dentists that are
Sure,
available.
so some sort of transportation system that would do that, and that may be the biggest barrier they have, so that's a good point.
So, if it's a certain day of the week, or a certain time, well, basically a certain day of the week, then, they could all get their appointments around the same time. Can we see if that is available?
Mhm.
Do we have the transportation to be able to do that? Do we have the funding to be able to do that?
Sure, I would say we don't have the transportation, but that doesn't mean we can't. I mean, there's a service that will take veterans to their appointments at the VA. So is there something similar that we could do? It would be, like you said, a certain day of the week, and they can go down and work it out like that. I've often wondered, TARP out of Louisville will come, I don't know if they've made it quite to Charlestown yet, but they're getting close with their bus service, if they had a route.
I have seen them in Charlestown, as far out as Charlestown. I have not seen them as far out as New Washington, so
no.
I don't. But,
I just don't know if it's worth, starting those conversations just to see. So, I'm sure if the business was there, they would be interested, so. Obviously, this wouldn't be an everyday thing, but you said one day a week, if people could work that out, then. So, we'll see. Okay. Anything else health related one? What would you like to see?
You think you get your- okay. So Laura Macon is here tonight. I had maybe mentioned something at the end of the last meeting, but, someone had given her my information and I thought, she has some ideas on some things with those autism spectrum disorder and us being a more friendly community, to those on the autism spectrum. And so I invited her here tonight to
Okay.
to share what she's trying to do. Yeah,
It's Laura Wall.
I'm sorry, Laura Wall.
Laura making some microburger.
Okay.
There's, a few of us that have just started working on trying to, I guess, increase awareness and with autism. I have a child that's on the spectrum and, I know it's been really difficult to find services and just, you know, the understanding and, the reactions, you know, they're needed to help with situations and have, you know, anybody that's on, you know, on the spectrum or even having other kinds of sensory issues or, social anxieties or anything like that. So we have just gotten started and we're trying to find, I guess where we fit in the community or to help with that. I reached out to the mayor's office. I have actually talked with a county, in Florida that has the autism friendly designation, to kind of see what steps they took
Mhm.
for that. I have an agency that works mostly with autistic children that is willing to help us with that too. She's actually kind of out of Charlestown, but she has, she provides services to people in this community too. There's also Autism Society who is willing to host a community-wide event this summer. We'll do like a one-day training and offering, resources, for families who have children on the spectrum, that may not know about certain things that they can utilize, like the waiver program. So I guess I was just kind of wanting to see, if this, you know, what you guys thought about, if this is something that you guys would be interested in.
Sure.
working on.
I mean, I think, you know, we're just getting started, but I mean, you know, well, no, I don't. I mean, going back to some of the things that they've done for veterans, you know, they have a day called a stand down where these different resources come together and people can come and just get a feel for what's out there. So we might do it just specifically for autism, or we may do it for a number of different things
Right.
and just kind of have our own stand down, as we call it, to show people, you know, here's some resources out there, because I don't know, you know, I don't know how they would find out about this kind of resource. I mean, oftentimes it's word of mouth, and that's the only way, you know, and so unless you happen to run into someone who's run into someone, you never know.
Right.
And so,
Right.
yeah, I mean, I think.
And there is a lot more, and since I've been doing more research and kind of advocating for this, I've found more resources that are available that even I didn't realize were out there. So I think, you know, something like that would be good. We did partner with Hanover. They had an Easter egg hunt, and we partnered with them, and we have a lot of agencies also come and have a booth and make it more sensory oriented. So they had a lot of information about sensory issues and sensory items and things like that to showcase to the parents that came to the Easter egg hunt as well. So I think having more things like that,
Sure.
and building that awareness, and this isn't really a high cost project. I don't think it's mostly training, and the Autism Society training is free. Most of their information and resources, I think, are free. So it's just really advocating, getting more awareness out there, and training as many people as possible with the resources and.
Well, I think a lot, just letting people know that they're out there. I mean, I think that will start kind of the snowball running, or building, but yeah, so.
And then also, I feel like it's been a while since we emailed, but, at that time you were looking to have kind of like designated spaces in the county or city that kind of labeled as more sensory friendly, or that might not, that are more aware of that, right? Because it can be hard, even, I have friends whose children have to wear headphones when they go different places in public or things like that. And so having sort of safe spaces throughout our community to,
Yeah, definitely.
is something that,
And one thing, the autism friendly city that I was kind of researching and talking with them, they have a website that has like all the businesses that are autism friendly and how they're autism friendly, and their county government has like virtual maps of like all the agencies, the library, different places, so they can go in there and look at those maps and know exactly exactly where they're going,
Sure.
what it's like, if there's a sensory issue like lights like these or things like that. And then businesses who have like sensory friendly days, specific days, or sensory friendly items, or they dim their lights or offer headphones or different things like that. So it's kind of, I would love to see our community kind of work towards something like that.
Yeah, I mean, I think if you were to ask people, what is a sensory friendly place? I know, I mean, I mean, I understand, to me, initially, I went to flashing lights, but
Yeah.
yeah,
that too,
even,
but yeah.
LEDs as an older guy, I love them, because I can see now. Some of the other ones again, but, for others, it's an issue, so.
And even educating people that, if there are lights like this, or there's a loud noises that come by, like if an ambulance comes down Main Street or something, that you might see a reaction from someone that you don't understand, and you might get alarmed at, but maybe you realize maybe they're just trying to kind of regroup because that was a struggle for them to deal with.
Yeah, I mean,
It's a lot of overwhelming things that we take for granted
Sure.
because it doesn't overwhelm us, and it does them, and it's hard for people to understand that. And I think educating our whole community on that would be very helpful, especially our law enforcement and firefighters and
That'd be good. Yeah, I mean, and so I think we could either just do an event for this, or, and maybe that's this year, and then next year as we expand on things, but I mean, and once again, it is gonna be word of mouth as you start with that, and I can reach out to the new sheriff and see, because do you think they get anything at all? Any training at all, or?
I talked with, one of the Madison police officers, and I know they were working on, training. I think they have to have some, I don't know how much it is. There's a lot of, tools out there that they could utilize that I don't know if they have access to or know about necessarily.
Sure, well, I mean, I think that's probably the biggest hurdle right now.
yeah, I could see that they probably need training, as well as probably jail officers, because when I was at Jefferson County, there were times that we had, people on the spectrum who were incarcerated, usually from some explosive disorder as well, or impulse control, and, but maybe if law enforcement had a little bit more education,
Sure.
I think they might not
Well, I mean,
have been there, and then
unfortunately, the
medical
jails
data
have
to
become
the
the
judges.
mental health facilities in
We're the
our
largest
community,
provider
right? I
in the
mean,
US now, mental health.
so we don't, 'cause,
And you don't necessarily, there's such a spectrum, there's such a wide spectrum of mindset's high functioning. And a lot of times, they'll label him as, it's behavior issues when that's not what it is, so. And back to, education and understanding, what's going on, is important. And I think there's a mental health first aid training that I went through that's that was amazing because they talk about, how you escalate behaviors. There was like just a list of things, how you escalate and how to de-escalate behaviors. And a lot of things that I think you just normally would do probably is escalating a behavior, and the de-escalation techniques are not, they're not, something that you would normally do or react that
Sure.
way.
I mean, as
So-
humans, it's not gonna be our
Yeah.
first response.
Yeah, so
But
like
knowing-
just giving someone space, even when they're in kind of a little bit of a meltdown or something, and backing away and giving them space. And we probably have a tendency to want to get
Restraining.
more involved, yeah. So things like that helped me tremendously, just learning those kind of things. And that's an awesome training for people to go through.
And who puts on that training?
I'm not sure. I can
I
find
mean, my
out.
company does it in the jails that we're contracted with. I know Jefferson County's just gone with a new contract. I don't know if it includes that with theirs, but,
You can
there's
find
probably
out.
other places that do it, but I've been through it and it was great. And it was great to see the officers that went through it having a lot of aha moments, so.
Yeah, it's
through
amazing.
that.
Really.
So if you wanna collect some of that information, I mean, we can kind of talk on, do we wanna rent Brown Gym for a day or part of a day and have something like this? I was gonna say outside, but you always are fearful if you say outside, because then you just never know what you're gonna get with what, but, I mean, the stand down, they had it in Brown Gym a couple times, they had it in other venues, but we, to work out something like that, like I said, maybe for our first year, it's best not to do the.
Or a space that you feel like would be.
All
more
right, yeah,
conducive,
that's
Like,
another point.
Yeah.
Maybe the lights kind of, not even, the lights in Brown Gym there, or something that,
The echo.
okay, so,
Does your group have like a set, brochure or just information, like if someone was to walk up to you right now and say, hey, can you set up a booth for autism? Would your group be able to do that?
Yeah, I've done that. I did that at the Easter thing, but it was me collecting a lot of different information from other resources and just having that booth. So we're very informal booth, so we don't have anything of our own. The Autism Society is willing, though, to come to Madison and offer a whole day's worth of training for free this summer.
so,
And they actually just did a training for us, at my work. So they're willing to, and I think they were talking to Madison Police too, about doing a training for them.
Would you work for DCS, correct?
Yes.
Okay, yeah.
So they're willing to do trainings for free for anyone that wants to listen. So that's another resource.
okay, I mean, if you put a little bit of that together, let us know what places would be good, and cause I think as we kind of talk, do we wanna add some of these other things that we've talked about into this? Is that just too much for us to start with, or, we can get that off pretty easily, so maybe, maybe August or so, we'd have a time where, we could do something like that, maybe. Yeah, I think
They
it's,
mentioned the library, I don't know, maybe because it's quiet and no lights out.
Yeah, and
usually.
they do have a room off to
Yeah.
the side,
Mhm.
where they'll have like presentations there at the library. That's got a decent amount of space. And you know, Dr. Cook there a couple months ago.
and maybe, that would be. You hate to get a big venue and you have like 6 people in there, I mean, in that way it would be small enough, and if we need more, then we can do that as we grow in the years to come, so. So, give us some tentative timeline or so, think about it, I'm not saying tonight, but then we can start talking to the library to see what their availability is. I think that would be a good, something, that's not a spot I normally think of, and I think that would be a good location to start with.
I'll reach out to the Autism Society
Okay.
again and see.
And it may be there that, they come and give us some information, but also talk about this training so we get those folks to come, because once again, I don't think a lot of people would even think that's available. And, I mean, like I said, I mean, it was such a good thing for you, but people don't know what's out there. They're,
I mean, and I could see teachers coming to this, other people within the community that just haven't had training necessarily that would be helpful. But really, I think if you advertise it to friends, family, teacher, you know,
yeah.
that knows someone on the autism spectrum, this is an event for you, you know, or an opportunity. You
And
have my
most
email,
people-
so as you kind of collect this, if you wanna just shoot it to me and then I can give it to.
Okay.
Most people know somebody on the spectrum, whether they know it or not.
Right.
Right, I'm like, yeah.
And it seems to be getting more prevalent, I think, too, so. We're diagnosing better, maybe
Yes.
that.
Okay, so you had some time now, we asked them, you have anything?
That's a lot. You know, the only other thing, and this is probably a pipe dream of some sort, but, it'd be nice if our community had something for, more offerings for like outdoor activities for people of all ages. You know, we have the Heritage Trail, which is great. You know, my kids probably don't care about the Heritage Trail. They probably they'd like to have a rock climbing gym or something like that. But you know, just in terms of health, mental and physical health, too many people playing video games and
I agree.
could be more productive outlets.
So it's funny you would mention that, because although it was probably about a year ago, I got a call from National Fitness something. Anyway, they were gonna put, they were looking, they wanted 5,000 fitness pads. They were 40 by 40, kind of the from rubber kind of thing, but they have like 8 to 10 different exercises on them, but they were, you know, they had like a QR code, you could scan it in and that would take you to an app that would take you through the exercises. And we thought about trying to find some spots for them. I think you've recently seen that there is a funding source for some of these that has helped park in DuPont and swimming pool in Madison. So some ways to put something like that, to get that together, where around the county we can do some of these things to encourage folks to get outside and just, you know, you don't need a lot of equipment. You just, you know, you can do some really light exercises, or, you know, they had pull-up bars and some other things. And when they told me the price, I think it was like, I'm sorry, I'm in the government, I'm gonna say this and you're gonna like, well, it was like $180,000, which to me wasn't exorbitant, too much. I'm an engineer. Anyway, so, but you know, I thought, what a good thing to do to try to, you know, find some spots around the county. I mean, obviously there're gonna be some in the cities, but trying to find some places where we can encourage that. And it, you know, it seemed to be relatively low maintenance. They also had part of it was where some of the pull-ups and those sorts of things, there was a wall where you could invite artists to do some of their artwork. They had some they would give you, but, you know, they also said, you know, if you have people in town that want to decorate this, let's, you know, make a contest or give some people some space where they can do that. So, yes, I agree. And so I'm going to reach back out to them, especially with the Bethany Circle show, and they're interested in that. And let's start something like that. Because I think physical health and mental health do go hand in hand. And I know how much better for me, I usually walk 2 miles at lunchtime, how much of it's not real strenuous, but it's a great, just clear your head. A lot of nervous energy is gone and, okay.
Sorry, there's just, so you know, at Johnson Lake, there's the trail that goes around the lake, and there's exercise stations there. I don't know how well maintained they are, but like all the way around the lake, there's some different kinds of exercise
Oh,
things that you can
Oh,
do.
okay,
with
gotcha.
that information.
Kruger Lake has it as well,
Oh.
and that may be a place where we are investigating maybe a campground out there, but it would include some trails, more trails and more physical stuff for folks. So, yeah, that's a good point. And maybe that's, you're trying to find locations where it easily accessible, people can walk to it and use it, 'cause I mean, we could put it out in the put it out at Jefferson Proving Ground, probably not gonna get a lot of use out there, but there are some other places, and and I was surprised that, 40 by 40, not huge, but still had a lot of things kind of packed into that small location, so. Anything else? No. Okay. All right, so the other topic was human relations, so, gonna get a lot of that's gonna come out of the health side as well, but, anything, any communities, any things, thanks for coming.
Thank you.
Any, how do we wanna reach out and help folks? I mean, I think that's something we've talked about, we wanna make Jefferson County a nice place to live, we wanna show people that we're not just gonna, we're gonna try to, I don't know what we can do, but I think if actions speak a lot louder than words, and if we can go and try to, maybe it's clean up a community, clean up a block for people, help them do those sorts of things. And, maybe those that don't get a lot of attention every once in a while, so. Those are kind of the lines, along those lines, so that was kind of the seed to start the discussion, so any thoughts? Anything, I mean, it is a blank piece of paper, so, let's shoot some ideas out there and see what we think. Yeah, I mean, obviously, we're gonna get other people to help us, it's not gonna be the 9 of us going out, but I think when you show that, people are they're gonna wanna get involved, they're looking for things to do where they can help folks. I mean, I think you've had two things come out of the pandemic, some people that just wanna stay in their house and never go out again, but you had other people that just wanna get out. Just let me out, give me something to do, and so, let's make it good things to do.
Well, do we have a place in the Madison area that we can do something similar to like a community garden?
So I know that there is some talk about, and so maybe we partner with, there is a community, it's, I think it's community garden, community grocery program that they're trying to bring together, so maybe that's someone we can reach out to and see if they've got a specific area, and then we can go in with them and kind of help them along those lines. So, I mean, we have some, there's some farmers markets going on, we have one, do we want to expand? The county has a few pieces of property where we could do some others, on a Saturday, allow the farmers to come and have a place to sell their goods, but also have people have an opportunity to come and get fresh produce. So, we've looked at a couple places for a community garden, but we're getting in not an easily accessible location, so you're like, okay, that's probably not a good idea. But I know this community garden group is looking at some places that would be easily accessible, so.
And Hanover has a community garden.
That's true.
Like, they just are getting a pavilion built, so it's gonna be open to the public, they're gonna have fresh fruit and food plots out there, so.
So that's just on File Street?
Yeah, right near the police station.
Yeah. So that one entrance into the college, there was some.
They've really, really progressed on that. As a matter of fact, we went jogging that direction, there were 6 spots that were already trying to nibble on the little bit of vegetation that they've already put down. And they were so cute, very, very cute.
So thinking of other areas, but yeah, I think, looking to help them and see what we can do in that endeavor.
We still have like several areas in the Madison area that just lots, they're just, that maybe that person was not mine, but they used it as a community.
And like, we don't have to have, I'm just trying to start those thoughts. So, are there certain communities that, that just it's some older folks, or it's just some people who just need some help. How can we, and I don't think we wanna go and say, well, we're here to help, and this is what we're gonna do, okay, we just, maybe it's canvassing some of these places, what would help? What could we do? I mean, we can't guarantee that we can do everything they ask for, but we can try some things, and, I think there are times that it's a resource thing again, they just need some resources, and maybe just some hands to help, clean some things up. And that would, maybe it's, you could kind of model it a little bit like a Habitat for Humanity. Okay, we're gonna do it for you, but we're gonna ask you to put a little sweat equity into helping others, and to go on from there, so.
Do we have like a cleanup Jefferson County Day, anything like that?
It's a good no, but.
Cause I know there's like the river sweep and things like
Sure.
that, but. Where everybody, like, maybe something where like everybody gets a plastic bag mailed out and like you fill up a garbage bag.
Or even a recyclable bag.
Yes,
Because I know, so there's so many people, it's really hard to recycle,
Yep.
like your limbs, like, after we've had all these hard rains and they don't wanna recycle, even though we've been under a burn advisory, because it costs too, they don't have the means to be able to, they don't have a truck. They don't wanna haul it in their car and drop it off. But if we had, can we like look into getting something of that nature, like once a month? They sweep through and they get, if you have it at, at the end of your drive, they sweep through and they get all those extra limbs, so they're not burning. And so that they're not piling up and becoming a hazard.
I mean, I think we need some, so the county has six places around the county where you can come and drop off your trash for a small fee. So, but maybe we could make those, we're trying to, limit like construction type waste and all that stuff, but maybe there are things that we can do where one day a quarter, we're gonna have some things there where you can drop off bigger things. And so that's the whole point of the 6 locations was to try to give people an option rather than off the side of the road. You can take it so it's taken care of, and it's not gonna cost you a lot of money, but it's so.
I don't know if this is purely governmental. I think it'd be awesome for the community if the city dump were a little more user-friendly and inexpensive.
and
For
open.
example,
normal
Sure,
hours.
yeah, regular,
I don't-
the hour, like I've been there when, I had a load of stuff and I was in a relative hurry
Mhm.
and I got my 2 sons in the truck with me. And all I could come up with was as a teaching moment, I said, do you think those guys work by the hour or by the satisfied customer? And they got the right answer. But, I think there's just in terms of accessibility to people, I think there's probably a lot of opportunity there for community enhancement and cleanup. I think a lot of people would be motivated to clean up themselves, but I think time is a barrier a little bit. It feels like just kind of feels like you're kind of playing an away game a little bit, and it feels like you're probably
Doesn't feel like home.
yeah, you hope you're doing everything right, and
Well, and
it's not cheap, and so I think there's probably some barriers there for the community that might not be terribly hard to overcome.
no, I mean, I think the commissioners, we have talked about doing a a large item kind of day. You know, I don't know if we talked about doing it multiple times a year, but you know, sometimes during the year, so we could, at these trash collection points, we're gonna put some dumpsters where you can bring big things. And I think we could almost, well, I think we might have to have one that's, okay, this is like yard waste and this is other things. And try to work through something like that, so, I know it's not like, wow, I never thought of that, we have thought about it, it's just working through the logistics of making it happen.
Sure.
I don't know if the transfer station takes yard waste per se, but, that may be working a little bit to see, I mean.
Well, someone goes through every so often and they get the leaves at the end of people's drive, which would be considered yard waste. And then because they don't want people burning Christmas trees, they're able to find someone to pick those up. So I would think that they should be able to use the same ones for something as simple, not necessarily like, it'd be great to get rid of the large things, but for something as simple as we've had a lot of bad storms, we've had all these tree limbs fall down, we have trees that are falling. It should be fairly simple for them to find someone, the same people, to be able to get at least the yard waste, which would be just.
I mean, in the city, that works great, but when you get to the county and you're going 500 miles of road, it gets a little, so maybe we can have it, okay, you're I know it's gonna be, they're still gonna have to pick it up and take it somewhere just because but you know, it's worth, you know, I know the town of Hanover will do that. When your Christmas trees, I think they give you an opportunity to bring it in. They don't pick them up, but they'll let you bring them in. I don't know, I mean, there is a huge mulch place. So 256 and 65, I don't know if you know, to the west side of 65, there's new mountains appearing, and I don't know where they get their feedstock. Maybe that's an option for tree limbs and all that. I mean, because I think, you know, a landfill, they don't want to put, I don't believe they want to put yard waste and stuff like that in there. Sometimes it may help things decay better or not, I don't know, but I think they kind of shy away from that, and so, but that, you know.
Where they sell the mulch there?
That I don't think so, I think that's just where, you know, then they will, I don't know that they package it, but ship it off in trucks to landscapers and nurseries and stuff like that, but when they come off the highway and you look over and you're like, that's a mountain and a half of mulch over there, it's usually steaming, and so it catches your eye as you drive in, but, you know, and there's probably other people that do that, but, you know, finding those outlets, where that's, you know, that's it. So in I guess my first engineering life, I did a lot of that, but you find people who, you know, you have something and you think it's really not worth much, but to this other guy, that's what he needs to, you know, and so, you know, it saves you money in getting rid of it, and it saves him money in getting, and so finding those relationships, advantageous for both of you. So that might be a way that some of that would work. I don't know if they take leaves, that, you know, maybe there's, you know, kind of a composting thing. Is there someone that does, you know, a nursery that does that? I don't know. That's another. So we can start with some clean up Jefferson County. I think we could do that, and we can kind of talk more about what that would look like if it's, you know, once a quarter, once every 6 months at these trash collection points. We have dumpsters where people can bring some bigger items. I really, it's amazing what people will try to put in a garbage truck. And so we may have to have a little bit of limitations on that. I know
When I hear that word too, like clean up Jefferson County, I feel like besides just those ways, that we already have days in our county that are set as like, there's drop boxes all the time at like the sheriff's office, CVS, at the hospital, I think, but for meds and syringes. And so that, I feel like that we could work with them on their days as well, just like these are all cleanup efforts to clean up your home, clean up our community for better
Sure.
health and safety and all of that. So it's just something to maybe consider.
I mean, working with it's a long list of letters, Southeast Indiana Recycle District, SCIRD, out at the Proving Grounds. They have days where, I don't know them off the top of my head, but like hard items to get rid of days. So you wanna bring some tires, they will take, there's a limit, there's like 4 tires you can bring in for free. You have electronics that you need to get rid of, there's one day in the month where you can bring those in for free. So publicizing those, but maybe working with them where we kind of help their feedstock, so to speak, but allow people a little bit easier access to that. I mean, right now, if you don't go looking for it, you're not gonna know what's happening. I mean, you
Right.
try,
Right.
but, so maybe publicizing more of that at the, cause at
I
these
think they have
tracks.
shredding days as well.
So I mean, they have a number of different things out there, so. Can reach out to Aaron Bells, the director out there, and just maybe have him come and talk to us and, start that conversation. I'll see if he could come to our next meeting or one of our next meetings and tell us what might be some opportunities that we could work with them or ways that we could help them. I know that, a lot of things that you try to recycle, it costs money to recycle them, and so that's been why things have gotten more difficult to recycle, because.
And it'd be nice if does that same person have anything to do with the recycle? I'll use myself as an example. I was very ignorant to the fact, I did not know you cannot recycle styrofoam. I thought I was doing this very wonderful thing, and I
Sorry.
had 2 great big huge styrofoam coolers. And I thought, oh, and I won't use any plastic. I'll put all the other recyclable stuff inside of this. And they just drove just as kind and nicely, and all the ring alarms go, oh, there's someone in front of the house. And I looked outside and he didn't take anything. And I thought I was doing such a good job. And so I walked out and I asked him, did I do something wrong? He said, I'll empty the stuff out of there, but I'm not really supposed to, but I cannot take any of your styrofoam. That is not recycled. I had no idea that did not recycle. And when I was talking to my coworkers about it, they had no clue either. Because you see Polar Pop, styrofoam
Mhm.
everywhere. I mean, it's on the side of the road, it's on the highway, it's up the hill, it's on Heritage Trail. You constantly see Polar Pop styrofoam everywhere. I think it'll outlive us at this point, because there's so much of it, and you see it.
In plastic bags.
So now I'm kind of curious, like, what happens to that styrofoam? And why are we still using that styrofoam? And so, it'd be nice if someone could let us,
I mean,
educate us on what can be recycled and cannot be
right, I
recycled.
mean, they have that, they go to the schools and have days where they do that, and that would be fine for us. Here are things you can, here are things you can't, or at least there's no program right now for it. And, they get government funding, but they're not trying to use that just to recycle anything. Okay, this is gonna cost a bunch. I mean, they tried recycling tires. Tires are difficult. Used to be, you could put them through a cement kiln, because when you burn a tire, what happens? I mean, it gets hot. It gives a lot of fuel value for them, but I'm pretty sure the emissions were an issue, and so now they kind of stopped that. So you grind it up and you make, right, well, you could do that, you make tracks at schools, you make fitness pads around, because they're all taking that. Now you have to get the metal out, obviously, but that's one of the recycle routes they use for tires. But yeah, so we get Aaron to come, and I know he's got that information, because that's what they do. And they've tried, and maybe that's something that we can work with them at. They used to have recycle points around the county, but unfortunately people use the recycle bins as trash bins, and then it's useless. And then they're like, okay, it's happened enough, we're not going to do that anymore. So are there things that we can do to try to help bring it back, but also help them keep it recyclable material, not trash?
I'm sure people are, I'm sure it would work very well if you're educated on it. Like I said, I'm using it as an example. I would have put styrofoam, broken it up, I would have never have thought not to do that. So if you don't know,
Sure.
then you're not going to do it correctly.
And, early on in recycling, if you mix things together, it stayed right there on the end of your driveway, they weren't gonna touch it, and so over time, people are like, all right, we gotta let them do that, so then separation facilities came up, and then they'll do it themselves, but yeah, I can remember, you put colored glass with the clear glass, ooh, no, I'm not taking it, I'm not taking that, and all the different, the numbers on the bottom of the bottles, you gotta follow that. And, some of it is, in styrofoam's case, usually when you're gonna do that with plastics, you're gonna melt it down. Well, styrofoam just goes away, it burns off and there's nothing left, so there's really difficult to use that kind of process to recycle it. If you could grind it up somehow, but when you grind up styrofoam, what happens? It's just flying all over the place and it's a mess. So you're right, finding a different type of material, like your polar pops going in is the best route of recycling, and of course, the styrene guys are gonna be upset at you, because you're not selling them. All right. Sorry. Anything else? Other things? So think about those sorts of things, so we can kind of get some ideas, and like I said, then we can prioritize them. Some of them are gonna be pretty easy, getting with a group that's doing it already, and how can we help? Some, it may be a little more challenging. I'll try to see at this mulch plant, if there's some contact information that we can get in touch with, and just see where they get their stuff. They probably like storms, because then they get a lot of people want to bring in a lot of stuff. I don't know. Who knows? Okay, so kind of list out the rest of the meetings for the year. I've got tentative on the 27th, and then the other one is the 28th of December, 27th of July. And right now, on the 27th of July, there's a commissioner meeting scheduled, but I think it's going to get moved. But I will find out within a month, and I can let you know. The fourth commissioner will take care of us when she sets up whether it's good. Okay. I don't know that we have any action items other than just think about some of the things that we've talked about and kind of get some ideas, because it's, as we get finished with something, we're gonna wanna have other things. And I think, some of the ideas are gonna lead to other ideas. So let's just kind of keep a list of those things. So I'll kind of put these together and send them out. And, just kind of prioritize them. What do we think is most important, and what's not, and then we can talk about that more. Anything else? So we need to make a
Can
motion.
we maybe also send out a contact list or exchange because I don't have like anyone's phone numbers or email, just see you
Okay.
guys like once a month, but
Sure.
maybe.
So I'll send out this list with everybody's email address. If you would reply with your phone number, would that be okay?
Yeah.
And then I will, once I get them, I'll put them in a list and be nice, but for the short term, we'll do it that way. Okay, you okay with people going? Sure. I won't talk. My medical issue, just I'll wait till the 15th of May when I have my appointment, but. That's all right. Haven't had any calls from, All right, so usually we'll make a motion to adjourn. I don't know that we need to do that officially, but we are adjourned, so. Thanks for coming.
Very good, yeah.